from Orthopaedic Nurses Association of WA, which is the local chapter for ANZONA. I'm also the publicity officer for ANZONA as well. What we're going to be talking today about is clinical thinking in nursing practice. First of all, I'll be going over what clinical thinking is and how we can actually apply it to our nursing practice. There's a lot of literature available from a very academic point of view that analyses critical thinking, and I'm only going to briefly touch on those because my focus today, I want it to be more about how we can put it into our nursing care and nursing practice. We'll also look at the components of critical thinking, the attributes of people that are critical thinkers, and some examples within orthopaedic nursing of that. Blockers and things that get in the way of critical thinking, and ways that we can encourage and foster critical thinking within our orthopaedic nursing practice. First of all, we'll have a little look at what is critical thinking. As I've said, there's a lot of academic papers on this. Here was one definition that made a lot of sense to me and one that I could relate to quite well. And that was the APA definition, saying that critical thinking is purposeful, self-regulatory judgment that uses cognitive tools such as interpretation, analysis, evaluation, inference, and explanation of evidential, conceptual, methodological, criteriological, and contextual considerations on which judgments are based. And as we can see, that's all very, very pertinent to our nursing practice. Put a little bit more simply, it's the capacity to question our actions and our decisions that are made either by ourselves or by the others that we're working with, or the capacity to imagine alternatives that may be more effective within our practice. There's quite a lot of components of it, and another part of it is it's the application of our knowledge and our experience to identify patient problems, to direct our clinical judgments, and also to guide our actions and that result in positive outcomes. And they're not only positive outcomes from our point of view with what we're trying to achieve for our patients, but it is also the positive outcomes that our patients are wanting to achieve out of our care. And that it's important that we consider this with a lot of our decisions, with a lot of our assessing. What we need to do is to know what is the desired outcome from our patient and their family's point of view. Why do we need to use critical thinking? Because of the complexity of our care, the complexity of healthcare at the moment, we need to be able to respond efficiently and effectively to a variety of problems in many settings. And certainly when we look at our orthopaedic patient population, it covers both trauma, elective patients. We've got patients right across the lifespan that we need to be able to respond to with all of that as well. A lack of critical thinking is shown when nurses are only following protocols, do not individualise our care to our patients. And also without sound judgment within our practice, we're only really performing tasks, and that's not looking at the best outcome for our patients. So people that are critical thinkers, and what I want you to do at this point is think in your mind of someone that you work with clinically or that you have worked with clinically, that you really hold up as someone that is very, very good in their practice, very, very good in their care, and is making a big difference to your patients. The sort of attributes that we see is that they are self-directed, they're self-disciplined, they're self-monitored, they're also self-corrective. Other attributes that they may have is whether they're flexible, confident, inquisitive, because this is really a key to being a critical thinker. They need to have integrity. Perseverance is quite often needed because solving problems isn't often really, really easy to do. It's something that we need to persevere with, and certainly to improve practice as well as requires perseverance. They're people that are reflective, and they're also people that are open-minded, because when we're closed-minded, we're not looking at better ways of doing things. So how do we apply the critical thinking to our clinical setting now that we know what it is? First of all, through our clinical decision making and also our problem solving within our practice. We do that through selecting and organising pieces of data within to do with the patient to support our conclusions. It's right comes down to the very basics and what we've always learnt about and what we've talked about with the nursing process. It's assessing patients, planning and evaluating their care. It's also looking at the responses to their treatment and care and are they effective. So again, it's coming back to that evaluation. It's selecting information and it's information that's the most pertinent and organising it into meaningful patterns. That may be the difference between someone that's a very, very experienced nurse to someone that's come in very junior to a new specialty, is organising that meaningful patterns in what we're seeing and what we're doing. It's asking ourselves again, has the patient reached the desired outcome? And if they haven't, it's going back to the start and having a look at all of that program. I said before, it's about patients' view of desired outcomes as well as what the clinicians are wanting to achieve. And that needs to be morally based for the patients as well. For example, if you've got a patient that's refusing treatment, that's not a desired outcome from our or their point of view. It's having a look at questioning it. What is the probable basis? Is it a misunderstanding on their part? Is it a misunderstanding on our part? Is it because of fears? Is it catastrophic thinking? Is it something that they've read along online? For example, most of our patients that know they're coming in for something will be researching things online. Are they getting the information from the right points of view? So it's really having a little look at those desired outcomes on ours as well as their behalf. When we're looking at our clinical problem solving and our decision making, it's encouraging the use of accurate comparisons. And again, this is something that comes with a bit of experience. It's thinking ahead to the next step. What is the possibilities of what's going to happen? Having gut feelings or acknowledging our intuition is a really, really important part of our critical thinking. Quite often they think that it may be our knowledge or our experience that is setting off that intuition with us, even though it may not be right at the forefront of our brain to be saying, right, that's exactly what I'm thinking right now. But we get that hunch or we get that nurse's intuition. And then what we need to do is we need a bit of factual stuff to be looking at it and backing that up. So follow your hunches, but then test it for accuracy as far as getting more information with all of that. Let it be a red flag for yourself, but not an absolute truth. Okay, and when we're doing all of those processes, it's asking the why questions behind what we're thinking, what we're doing, what we are feeling to do with the situations. Anything to do with critical thinking in our patient care needs context. Okay, there's not a one size fits all for our patients, and certainly through orthopaedics there isn't. So the context of the situation that you're faced with, what we need to be doing again is getting much more information available before we're making any decisions or solving any problems. So the context of the patient, what is their past medical history, their comorbidities, their current medical problems that may deviate them from the way that we would normally look at what they're facing. What are the current occurrences? Identify the need for what other information that you require, whether it's investigations, whether it's x-rays, all those sort of bits and pieces. Make assumptions as to the reasons for the current problem that they're having, but then seek the evidence to back those assumptions up. Strategies to actually assist ourselves with critical thinking. Some of the strategies that we can do, not only for ourselves, but also the others that we work with, is thinking aloud. So when you are doing this clinical problem solving or decision making, that you're explaining your reasoning. And what it will do is not only is it to help yourself with it, but particularly your junior staff, that's how you can be starting to get them within that critical thinking frame of mind. It also works when you're dealing with medical staff or allied health or any of your multidisciplinary team about the need for action for that patient. So what you can do is be thinking out aloud, providing your reasoning to try and support your patient and that action that you're wanting to have a look at. Another strategy is to have short education sessions where clinical scenarios are brainstormed and you can be showing this critical thinking. I've just popped on here about handover and using handover effectively because this can be just such a powerful tool for encouraging clinical thinking, critical thinking within your clinical area. And certainly we go back to the old days and back in history where we used to have a full ward handover, everyone was together within the room. And what would happen is a lot of teaching was happening during this time. The other thing was the more senior or the more experienced staff were actually role modelling the critical thinking and the problem solving that they were going through. Now we no longer have those great big ward handovers, but we do still have, you know, handovers, whether it's bed to bed, person to person that we're doing. And it's a case of staying away from it being very task orientated in the way that we hand over. Okay, it's a really easy trap to fall into that we give information that's easy enough to find out otherwise. It's very task orientated. For example, so-and-so patient had a shower today, they've had their bowels open. Okay, the nurse that you're handing over to can find all of that information out easily enough. Don't fall into the trap of trying to justify what you've done during your shift, particularly when you've been really, really busy. It's a very easy trap to fall into. For a much better way to do it is to talk about the key issues that are facing your patients. Look at the need to know things that you need to be passing on to the next shift. If you're the one that's receiving the handover, prompt them with questions. Okay, so what are the key need things to know? What are the outcomes that the patients had from the interventions that they've already had? Okay, there's quite a lot of ways that they break down handovers and a lot of letters to sort of remember them. One of the ones I always think to keep it really, really simple is SAO, as in the SAO biscuit. Look at the situation. What was the action you took? But the most important part is what was the outcomes. So for example, if you've given a patient some analgesia, that's the situation was they complained of pain, they've had the analgesia, that was the action you've taken. But the most important thing that you can hand over and, you know, critically think through or encourage the next shift to critically think is by sharing the outcome of the analgesia that's been given. Was it effective? Was it not? Okay. So by using handovers, that's something that we can do quite effectively to be trying to encourage a lot more critical thinking within our clinical practice rather than making it task orientated. Okay, reflective thinking is another way that we, for our personal selves, can encourage our critical thinking. And we always hear about reflection and reflective thinking, but what is it? It's really learning from an experience, not the actual experience themselves. Okay, and it's something we may not necessarily formally do, but certainly, you know, those times that you wake up at 2 o'clock and 3 o'clock in the morning, you think, have I done this? What happened with this? We do tend to use reflective thinking, but it's channeling that in to really stop and think about it, what is going on and what are the things meant, and particularly, again, coming to outcomes. Right, I thought about this situation, this is the action I took, but I want to really think about the outcomes that came from the actions that I took, and then taking it to the next step. What could I have done better to make that a better outcome the next time that we can do, or the next time that we're faced with a situation? And that way, the experiences that you're gaining along the way will really guide the experiences that you're having in future to be improving outcomes for our patients. Critical thinking is all well and good, and we certainly do need it within our practice, but that doesn't mean we just go off making decisions on our own without any basis to them as well, or that we sit back and try and problem solve every single situation that we're doing. What it can never be without is the structures and the standards of practice that are in place already. It can never be done without accountability, Quality nursing care always needs to be the motivation and what's underpinning what our actions are. We need the ability to act quickly within the clinical areas that we're working in. It'd be great to be able to sit down and problem solve it for about an hour or two. We don't have that, okay? So it's working quickly and acting quickly, and then sometimes it's reflecting later to guide ourselves ahead and do it better for the next time. It requires good communication because it's not something that we can do on our own. We need to be working as part of a team, and being able to communicate the problem solving or the decision making that you've been involved with will really aid to move it forward. And as we've already said, it's the context of the situation that really needs to be taken into consideration, or the contextual perspective. And with an orthopaedic example of that would be if you've got a young patient that has been admitted with a proximal fractured femur versus someone in the next room next door, which is an elderly patient with osteoporosis who's also been admitted with a proximal hip fracture. We know, and people that are really experienced within the orthopaedic care know, that they are two completely different situations. You've got one with a younger patient that's most likely been a really high velocity injury, possibilities of multiple trauma at the same time, versus someone with the elderly that it's most likely been a low velocity injury. It's to do with the osteoporosis. We're needing to take in their comorbidities. We're needing to take in their social situation. We can't say, right, we're going to give those two patients the exact same analgesia and the exact same care, because the care and the priorities for those two patients are going to be completely different from each other, and they might as well be completely different injuries, even though they're proximal femur fractures, because very much the actions we take and the outcomes that will come from those actions will be quite different. So as we say again, health is not a one size fits all when we're problem solving. Okay, we talk about the standards of practice, and this is underpinning our management. Doesn't mean that we just get those standards of practice and we say, right, well, this is exactly the way that I'm going to do it all the time. What we need to be doing by being a critical thinker is really evaluate the standards of practice and the protocols that we've got in a clinical area. So have a think about, are they outmoded? Is new evidence available that will actually improve those standards of practice? Is there breakdowns in the practice that's happening, or is there issues within your clinical area with the compliance with those standards of practice or protocols? And if there is, we need to know why. Okay, and the chance with why is maybe that there is a better way of doing it. Are you seeing failure rates in the therapy or the intervention that you're using as well? Again, that needs to come down to that why question, and it needs to be evaluated and look at maybe a different set of action for that as well. Is there a better way to do things than what we're always doing? And what doesn't work? Okay, what is it about that that's not working? So even though they are underpinning our practice, it's certainly something that we can get involved with to be able to look at them, improve them, so that the standard of practice and the protocols that you use in the clinical area are much more relevant to practice, and again, to the outcomes that your patients and that excellence in care. So a few more ways to foster critical thinking for those that are more advanced within their practice is role modelling the practice that they want to see with the others, actively engaging in change within your clinical area, because that's the way that we're going to be seeing improvements. It's taking on leadership roles in designing our future practice environment, okay? Not just doing things the way that we've always done them, but, getting involved with that and actually driving the improvements in care. Sharing the problem-solving process rather than just the solution. And this is certainly when we're working with staff that are less experienced. Sometimes it's just easy to solve that problem for them. But if you can just take that little bit of extra time, try and work them through that process, encouraging them to those outcomes. And what that's going to do is it's going to take more time when you're initially doing that with those staff members. But in the long run, when they're problem solving at a lot higher rate and a lot better rate, they're going to make your job and your role within that clinical area a lot better. Okay, so it's time that's well invested within them. Some other strategies is getting involved, if you haven't already, within postgraduate education, because that really is a really good way to foster that critical thinking. It's not only improving your knowledge base, it's also improving the way that you're thinking and challenging you to have a little look at different ways to think, different ways to problem solve within that as well. Involvement in your specialty organisations is a very, very good way to do it, because what it does is it helps us to pool our wisdom together and to work together on that. It's a great way of getting multiple perspectives and comparing the observations of others as well. You know, for a lot of us, we will get together, we will talk about clinical situations, obviously in a confidential manner, but certainly we will talk about certain situations. And what can happen is that the others with experiences as well get those chances to share and to, you know, further what you're thinking and broaden different possibilities for all of that as well. Sharing expertise is certainly a way to go. And conferences, of course, is another way that we're broadening our thinking and learning from the experiences of others, because if they're sharing what their actions were, and particularly if they're sharing the outcomes, some of the pitfalls that they might have experienced, it just gives us a lot more ideas, and we may be in a situation in the future that triggers that thought with us, oh, right, well, I remember them speaking about that in this conference, and this is something that I can try, okay? It can be as simple as critiquing what you're hearing and what you're reading as well within all of that time. So we don't just take the information on board. What we're doing is critiquing it, putting it in context, clinical areas, and deciding what works and what won't work as well. Okay, so we've talked quite a bit about the experienced staff and some of the strategies that they use when they're critically thinking, but do our junior or our more inexperienced nurses need to be critically thinking as well? And what I say is yes, because their decision making may not be expected to the level that you're expecting of your really experienced nurses, but they need to know what are those little flags and what are the bits of information that they need to be able to report to us as well. So within their clinical load, what is the need to know information that they need to be passing on? How do they pass it on? What are the things that they can just, you know, decision making, problem solve on their own? What are the things that they need to take to someone that with more experience to report it to, so that that can be actioned as well? And that's something that we can, you know, encourage for them to do, the ones that are more experienced. And certainly with our junior staff, it's really good to, you know, take ourselves back to when we first came out, when we first graduated. When I was undergraduate through a university program, and as part of those programs, we are taught and we are encouraged and fostered to think critically. Okay, we do come out as critical thinkers. Then suddenly we hit the clinical area, time management just becomes one of the biggest challenges, and it certainly did for me when I was a junior nurse. And so that became the all-encompassing thing, was trying to get through my load and my workload, my patient load, trying to learn a lot of the different skills that I needed to learn. And somewhere along the line, that critical thinking just took a little bit of a backward step for a while I was just trying to get through shift to shift. And I'm sure all of us at some stage, you know, if we think back, may have had that experience as well. But it's making sure that we keep that switched on with our junior nurses, and particularly letting them know what they need to be reporting, being brought forward to us, encouraging them to, again, problem solve it through with us. So it might be the easiest thing for them to come and say, look, what do I do about so-and-so? And it would be really easy just to answer it off the top of our heads, and that'd probably be the quickest way to deal with it as well. But it's much better to tell them where they can find that information, Okay, how do you seek it? Where is the information on that? Put them still in charge of finding that bit of information, and then what will happen is they will tend to problem solve things a little bit more as well. Okay, our senior experienced nurses, have they got all their critical thinking right down pat? Well, that might need development as well. Okay, some of our practices and the way that we practice might just be based on the tradition or the habit or the way that we've done things. We've always done it this way, and I'm going to keep doing this way. And sometimes we can shut ourselves off to exploring what's new, what are better ways to meet our patient needs. Okay, so it's something that more experienced as nurses certainly need to keep working on all the time as well. Oh, sorry, just flicking through my slides here. So when we're working with others, we need to ask them questions about patient care and focusing on the outcomes. So really, you might not word it in those ways, but what it really comes down to is, and again, this overlaps with what we were talking about with handover earlier, is what outcomes are you trying to help your patient achieve? That's something you can question yourself, and it's something that you can question others. What do you plan to implement, or how are you going to do that? What are you going to plan to do it that way? What members of the multidisciplinary team are you getting involved? Okay, and these are some really good questions that you can ask, particularly your junior staff, when they're problem solving something as well. Other strategies are things about looking like things about case studies as well. And while you're doing a case study, if you're getting the chance to do that, is asking the audience and asking people to analyse and reflect on the situation. Could it be handled differently? Could it be improved? And emphasise learning rather than blame with things as well. Okay, when you have a critical incident within your clinical area or, for example, a deteriorating patient, it is really, really good, obviously, when it's timely and when you have got a chance to safely do it, is to go back over that situation as well. You know, quite often with a deteriorating patient, it's what you can call the tipping point, okay? Has that tipping point been identified? Was it identified in a timely manner? Have a look back through their notes. Have a look back through, for example, their fluid balance charts or their observation charts, those sort of bits and pieces with different eyes, knowing what the outcome was down the track, to see along the way what were the patterns, were there any trends, was there any information that I should have had at hand to be able to do that a little bit differently, okay? And particularly when things didn't go well, it's looking back on it, it's reflecting on it, and it's learning from it so that our actions next time would be really quite different within all of that as well. Okay, some other ways to improve your critical thinking, participating in committees. For example, we talked about policies and also procedural reviews or development. And through being involved with that, you can put in what you think is really going to work with your expertise. Be involved with ward-based, evidence-based practice and research programs as well. When there are problems or when there is a policy that needs to be reviewed, okay, who is the best problem solver? Really should be the people that are dealing with it. So realistic problem solving comes best for those living with the problem. So don't just wait for executive or someone else from outside to solve that. It may, first of all, it may never happen, or if they do, it may be a solution that you're not liking from that as well. So if you are getting involved with that, and certainly taking it from a critical thinking point of view, they will be actions, it will be policies that you will be a lot happier to be involved with as well. In summary, our expert nurses use critical thinking, and this is something that we need to develop in our less experienced staff. Some of the key components of being a critical thinker are using reflection, accurate use of comparisons, thinking ahead to the next step as to what will happen, asking questions, thinking aloud and explaining reasoning. And critical thinking involves challenging, examining, evaluating rather than simply assessing. Okay, one of the things that I've really always liked is this concept of being a lifelong learner in nursing. It's an old concept for quite a while ago, but it's certainly every time I read it, it makes me think of some of the nurses that I've worked with that I've really held in high esteem with their practice. So what I encourage you to do is to be a lifelong learner. So be innovative within your practice, be flexible to changing demands, be resourceful in your methods of working, and be able to work as a change agent. Also, share your good practice and your knowledge. Be adaptable to changing healthcare needs. Be challenging and creative in your practice. Be self-reliant in your working, and be responsible and accountable within your work. Okay, and if we have an orthopaedic nursing population like that, we're just going to have such excellence within our orthopaedic nursing. So thanks very much for listening, and I look forward to seeing you in 12 months' time. It's actually 12 months today until we've got our next ANZONA 2017 conference. And all of our Perth crew are looking forward to meeting you, and keep in touch with our Facebook and our ANZONA pages and Twitter page, and we'll be updating you all on the conference, because that's just a really good way to share all of this critical thinking that people are doing. I'm always amazed by people's perseverance, initiative within practice, and it's just going to be a great opportunity to share that. So thanks very much.
Excellent, thanks, Lindy. I'm just checking my sounds come through. It is. This. Yeah, this is such an important part of nursing practice. I mean, it's not elements of it are not unique to orthopedic nursing. This is things that are core to nursing, but there's the way, if we can reflect on our practice, if we can think about how we practice, I like the think aloud, just couple of slides you had there. That's I'm using that as one of my methods in my current PhD research to get a sense from people of the thought processes and the way that they go through and think about their practice in real time. And it's such a great way of reflecting on our practice and making sure that we're lifelong learners, like to talk about, is such an important thing. Also, you spoke about the language and how we present to other people. That's really important as well. Our knowledge is absolutely embedded and it's inherent in the way we talk, and it demonstrates a depth of understanding of the situation, which I think is really important as well.
Yeah, and I find certainly when you're dealing with multidisciplinary or with doctors,
Yep,
whatever,
definitely.
you're much more likely to get a better answer out of them, or to get the action that you're seeking from them as well, isn't
Yeah,
it? When you've sort of presented it to them in that way, instead of getting fobbed off or whatever, they're more likely to act,
yeah.
so that.
They'll have a
Mm,
confidence that you understand the situation. They can rely on that assessment that you've already done. I think that's really important, and it all goes to making sure that the patient's getting the best care. That's sort of
yeah,
what this whole thing centers on, I guess, and it's also satisfying as well to achieve that level of practice.
yeah,
I've
yeah.
I've only just recently read Benner's Novice to Expert, and sometimes, I used to think about that, it was, it's an old text and, it was a bit of a thing that we got excited about there in the 80s, but it's actually got some really good, discussion and information and thoughts about how people develop as expert practitioners. And it's really made me reflect on my practice, which I found really interesting. So, if you're bored one day and you've got a copy of it, I encourage you to have a little read through it again. It's really quite interesting.
Oh,
So,
that sounds good. That sounds good. I did actually read an article that she wrote on critical thinking, and that was where
okay,
some of the
yeah,
ideas that I got. But yeah, there's a lot that's really good, more from that academic point of view of
yeah, yeah,
critical thinking and what it is. But there's some really great ideas. in all of that, which I found it was helpful in trying to, I don't know, it's trying to get it in a nutshell as to what it actually is. Because you can have two nurses with 20 years experience, but both practicing in a really completely different way from
Yes.
each other. So it's more
She
than just experience and time, isn't it?
definitely, yeah, she talks about that, and Dreyfus talks about that as well. That it's not about longevity and level of experience. It's about all these things that you've spoken about, reflection about critical thinking. That's how someone becomes an expert. How they are able to deliver really good care based on really high level of assessment because they've developed those skills over time, not just because they've been around and seen lots of things. So it's
It is.
such an important part of it, I guess, and that's really what makes a difference. And yeah, how we can teach people to do that, because I think the problem is we almost learn. Well, some people who are really good at this critical thinking or reflection, they learn to do that, and they almost learn to do it without realizing they're doing it, and
Mm.
that can make it hard to try and instill and teach in others. So, making it more overt like you have in this presentation is really valuable, I think.
Oh, that's good. And I think at the other end of the scale, with our junior nurses, particularly your first year nurses, it might be the thing that makes one of them really, really stand out compared to
Yep.
their peers as well. And we can see it. We can't necessarily um, objectify what it is,
Yeah,
because it's a very
definitely.
subjective thing. But, they can be displaying those traits as well. And giving them the confidence to be able to say, look, you have got those traits coming through, so how can we develop that further with them?
Yeah,
And just encouraging it with it so that that's not being nipped in the bud and stopped, because they've got it, but it's, we don't want our clinical setting to be putting up to that as well by saying, well, look, no, this is the way we do it, we've always done it this way, you need to fall into line, because that they can come in with some really good ideas too. Mm,
yeah, no, that's true.
yeah,
Excellent. All right, well, thank you very much.
that's
Now,
all
is
right.
there one
I'll
more
just
slide?
stop the.
Yeah, there
Ah,
was one more
yeah, there
slide there.
was.
I just
Goodness,
thought
I
I'd better
forgot
put
about
that
that
on.
one. Oh, that's it. People who are willing to improve themselves are far stronger and more effective than those consider that there's little that they can learn.
Yes,
Mm. Oh,
very
that's a good one.
wise thing to say.
Yeah. Okay. Shall I stop the record
Yep,
now?
thank
Okay.
you.